The diagnosis process for late-onset Pompe disease for me took approximately 2 years. I got mononucleosis when I was a sophomore in college, and the primary care physician saw that my AST and ALT liver enzymes were elevated, and they stayed elevated for 2 months. Because of this, he referred me to a gastroenterologist, and the gastroenterologist monitored these levels for a year or a year and a half, because he always just assumed that they would go down, but they never did. Since they didn't go down, he did an extensive liver workup, which included a liver ultrasound, a liver CT scan, and a liver biopsy. All of this was normal, and he actually called me an interesting case. He referred me to a liver specialist at UNC, and she looked at all the results, and she told me my liver was fine. She did a lot of blood tests, including a CK, and saw that that was also elevated. So the combination of elevated CK and elevated AST and ALT made her refer me to a neurologist. When I went to the neurology appointment, upon manual muscle strength testing, the neurologist noticed significant weakness in my shoulders, in my neck, and especially in my hip flexors. This led him to perform an EMG, and he found abnormalities in my lower paraspinals, myotonic discharges, and that led him to think of Pompe disease. So he did an enzyme assay and then a genetic test, and it turns out that I had this disease. And I'm truly blessed that I was diagnosed very early before I was exhibiting some of the more severe manifestations of this disease, so I could get on treatment and hopefully halt the progression of the disease. And because I was diagnosed so early, and early diagnosis is so important in this disease because there is treatment, I wanted to raise awareness for this disease so that other people could be diagnosed earlier. And to do this, I decided to run a marathon. I got medical approval from Duke University, their Pompe team there. And since November 1st of this year, I have been training to run a local marathon. And the reasons being, one, to raise awareness for this disease among the medical community, and two, to raise money for a fund through the United Pompe Foundation. All the donations will go directly to a fund for people with Pompe-related needs and expenses to help them in their day-to-day life and to improve their quality of life.